Thank you, Madam Toastmaster. Today, I'd like to talk to you about the inequity associated with COVID-19. How did I arrive at that conclusion even before all of this press came out about it? Well, one way I arrived at it is early on in the distribution of the vaccine. As a member of the board and as a member of Rotary, we volunteered to distribute vaccines to the needy. We helped where the administrative task would prevent some of the distribution people from performing that service in a timely fashion. So we volunteered. Little did we know that the incompetent distribution channel would conclude that we were not entitled to receive a vaccine under those circumstances. We were suspended, reinstated 30 days later. Fortunately for the federal government and their rationale for changing the distribution methods, vaccines were delivered directly to community health centers going forward. So we were able to recover. But who really suffered? It wasn't the foundation. Yeah, we were injured personally, professionally. Our reputations were unfairly damaged. But those that really suffered was the minority community that didn't receive the vaccines that we were delivering. The population of Santa Clara or San Benito County is 56% Hispanic. During our delivery of the vaccine, we performed that 85% of those vaccines distributed were to the Hispanic population because of the nature of our mission. During that penalty period, those recipient levels dropped to 20%. So it was the minority population that suffered and were penalized for a decision of guilt before investigation versus investigating and finding the results of their investigation. Scary to think that we have those kind of decisions being made at the local level. Perhaps we need to look at this in a bigger picture. So I took it upon myself to read a little further on this subject. Blacks and Hispanics are suffering at a disproportionate level. In fact, life expectancy is lowest since World War II in those populations. Let me just share a few additional statistics. You are 3 times more likely to be hospitalized with the COVID during the pandemic, if in fact you were one of these 3 minority groups, or 2 to 2.4%, or not, excuse me, not percent, 2.4% more likely to die. The ratios are outstanding. I'm just shocked to learn of these things, and I wanted to share them with you. I specifically drilled down a little further into the Hispanic community because that is where 56% of the workforce and the employees and the population within San Benito County was. In fact, sure enough, on a national scale, 1/3 of the agricultural workforce is Hispanic. Labor rates as a result were more, jobs were greater reductions in numbers, still are 8.6% versus a white population of 5.7%. There were social aspects built in. The fact that there's multi-generational households within a Hispanic community allows you to think differently about, should we rationalize the distribution of vaccines based on age? When you're talking about multi-populations, the prioritization needs to be thought about and undone, perhaps. It was amazing to find these statistics out. Latins, of course, and Hispanics in general because of undocumented workers in some cases were reluctant to seek medical care, insurance, or hospitalization, certainly at a much greater rate. Uninsured populations were 2.5% higher than in the white population. These statistics were obfuscated by the simplistic solutions that we developed. We ignored those issues, and the results were shared earlier. But what can we do about it? What are the cures? Well, first of all, education, and that's part of what I hope to share with you, to inform you of these facts, to educate not just the public, not just the recipients, but actually the distribution channels, the logistics, the government people that are making these decisions without intended bias, but resulting bias. Poor decisions lead to poor results. We should also consider investing in our community healthcare workers in our centers. You've also heard about the investments that we're going to be making. In fact, looks like we are just passing an infrastructure bill, which will address broadband, increase the capabilities, build an equitable response emergency health centers. We need to be able to act like a fireman. When you get an emergency with a fire, you call, and the respondent is the delivery mechanism. Within healthcare, it goes from the federal government, actually it goes from the manufacturer to the federal government, to the state government, to the local government. Ultimately, once that decision is made, they decide who receives it, which healthcare provider is going to be able to put those shots in arms. That made no sense. Fortunately, the government took some immediate action and fixed some of that, but not all of it. Those are the actions that I wanted to share with you today. I want to get you as excited and feel as important about this issue as I do, and reach out to your congressman or anyone else to educate them, bring them up to speed, make things happen. Thank you, Madam Toastmaster.